Ladies and gentlemen, as we spoke yesterday, we want us to provide an update to Kenyans on the situation which is prevailing. It is true that at midnight, last midnight, of course, the doctors and the nurses in some of the counties went on strike, and the situation is still unfolding in the various counties. Of course, I also want to say that some of the counties, the health workers are working. Some are working fully, others are working halfway, or there's a bit of go slow. And therefore, this is a situation we found ourselves in that in the morning. We did brief you yesterday, and I want just to provide an update because really, as a national government, we have a responsibility to ensure that Kenyans do receive health. We know that the bulk of the workforce which we are dealing with in terms of the issues which are raised, 70 to 80% is under the employment of the county governments. But we have a responsibility to ensure whatever discussion which take place do quickly make sure that Kenyans do not continue to suffer. I also want to say that the collective bargaining agreements are predicated on salaries, especially for doctors. But that is also a preserve of the Salaries and Remuneration Commission, which is the body mandated really finally to discuss the issues of salary. I want to say that with regard to nurses, we have had a meeting with them this afternoon, a meeting which clearly the nurses, what they are looking for, the union, is a recognition agreement as a union representing nurses employed at the county level. That recognition has not been signed by 46 counties. And therefore, before we can talk of collective bargaining agreement, which gives terms and conditions of service, a recognition agreement is mandatory. And therefore, in absence of that, of course, even in discussions about collective CBA will not be correct because the various counties have not recognized that. The second one is the step of going into collective bargaining agreement, which are proposals which they have given. And therefore, the view of the Council of Governors and the ministry is that first, we have recognition agreement, and second, we pursue that with the discussions on collective bargaining. Now, the issue of recognition agreement, the Council of Governors had offered the nursing union that within 7 days, that is by Friday, because the county public service boards are meeting, they can be able to execute the recognition agreement so that that recognition agreement can kick in collective bargaining agreement. And the Council of Governors had also indicated that within 4 weeks, the collective bargaining agreement, which is really a document which has to be discussed in detail, consultations have to be made across government in terms of National Treasury, in terms of SRC, finally, which has the say on salaries, have to be involved. And with all fairness, 4 weeks is not a long period to go through that process to be able to come up with a collective bargaining agreement. That was the offer which was given after hours of discussions. At that point, they asked to go and consult, and they were to come back at 6 o'clock so that we can either agree on that position or they can vary that. Later, after 6 o'clock, the nursing representatives indicated that they are not willing to come back to discuss. Therefore, as far as we are concerned, that issue of recognition agreement followed by collective bargaining, we thought those are timelines which can be achieved, and then have the climate of calling off the strike to be necessitate negotiation. That is where we are with the nurses, and we hope we have written to them to resume discussion tomorrow at 8 o'clock with a view to end the stalemate. With regard to doctors, we had a meeting with them this afternoon at 5 o'clock and at 4:30 to be able indeed not to pursue the collective bargaining agreement, but really a return to work formula to enable discussions on the collective bargaining agreement which they have, which was signed in 2013. And in our view, when we started negotiation, there was indication that as a union, they do not negotiate past 5 o'clock. Therefore, we were left with 30 minutes to be able to discuss a heavy matter which is affecting Kenyans. In our view, that was not appropriate because discussions must be held in an atmosphere whereby people can engage, explore possibilities, and be able to come up with a solution to the matter at hand. And therefore, at that point, they asked for time to consult, and when they came back, they could only give an extension of up to 1 hour, and we agreed that for purposes of doing justice to the negotiation, which is a very crucial point because Kenyans need service, we resume discussions tomorrow morning with the entire body of doctors to be able to have meaningful dialogue, to have a return to work formula, and come up with a framework of moving forward with the negotiation in the context of the collective bargaining agreement, which they are putting forward as a document which needs to be considered. Let me just say this. The SRC is the body which is mandated to negotiate, finally to decide whether any collective bargaining agreement within the public sector conforms to the salary structure in the public service. We are aware that the SRC has done an exercise of harmonization and job evaluation, and they have a document which they use to advise negotiating parties on whether whatever the outcome of their discussion conforms to that, and that is first of all why that collective bargaining agreement was not registered in the first place in the industrial court. And therefore it is our endeavor that after the meetings tomorrow morning, we shall be able to reach an understanding with both the nursing union and the doctors union to be able to take the process forward and agree that they call off the strikes, which in any case have been, the Council of Governors have obtained an injunction, and therefore they are on strike against a court order, and also to be able to address the issues of nursing in the context which I've said, sign a recognition agreement with the Council of Governors and the various counties, and then pursue collective bargaining agreement. You will appreciate there is a process which has to be followed. The turnaround time, that process is what we need to reduce to be able to come to a ground whereby we can move forward with the staff within the health sector. Now, without the understanding, then it becomes very difficult to get to a solution. But it is my hope that everybody will sleep over the matter, and then in the morning we be able to address it. We have discussed and gotten feedback from various counties. It is true some services are not running, but we are through the Council of Governors and the county public service boards and everybody, including our colleges which are spread across the country, we are making contingent measures to ensure that we man to the extent possible the health facilities. We are also going to engage, as I said yesterday, faith-based organization to ensure access of healthcare to Kenyans. We know that will not be adequate, but we have to do with what we have for the time being until hopefully we get through to the nurses and the doctors tomorrow morning. I think I'll stop there and ask Governor Ongwae to comment.
Thank you very much, ladies and gentlemen. Just like the CS has said, from the side of the Council of Governors, I would want to indicate that we have total commitment to this process, and that that commitment is shown by the fact that as governors, we were here yesterday from 10 o'clock. Yesterday was a Sunday, and we were here. I actually left here around 9, between 9 and 10. Those of you who came here, you were here around 9:30 last night. So we have total commitment from the Council of Governors on this matter. On nurses, what the CS has said, the two issues, the issue of the recognition agreement and the collective bargaining agreement. On the recognition agreement, we have already directed our public service boards who are meeting as we are speaking right now. The 47 chairmen of the public service boards are meeting as we are speaking right now, and they have been directed that those recognition agreements must be signed within the next 1 week. And that is a decision that those of us who are charged with this responsibility took this morning, and we have already informed them, and they are meeting as we are speaking. On the collective bargaining agreement, what we did indicate to the nurses that in the collective bargaining agreement that there are many other stakeholders who are involved. The Office of the Attorney General, the Office of the Salaries Review Commission, SRC, ourselves, the ministry. I suspect the Ministry of Labor may also be involved. All those offices are going to be involved, and it therefore becomes a process that needs time. The most important player in that process is the Treasury. And they also must be involved. And I want to say in that regard that last evening, when we were here with the Cabinet Secretary for the Treasury, Honorable Rotich, and even Sarah Serem was here yesterday. And so that shows you the commitment of government, that we've been given the mandate to ensure that both county and national governments are able to finalize this matter. The essence for us is the resolve that this matter be finalized at the shortest time possible, and we are asking you as members of the Fourth Estate to bring out this issue as well, because it's not even about negotiations. It's about our brothers and sisters, our mothers, our uncles and so on, who are sick and who need treatment, and we need to resolve this quickly. And that's why with the guidance of the CS here, we are all sitting here this time at night ensuring that this happens. The nurses were supposed to come back. As you can see, we've been waiting for them. They didn't come back. Just what we were agreeing with them were the timelines. That 1 week for the finalization of the recognition agreement, and the period that we had asked to ensure that the collective bargaining agreement is finalized. It cannot be finalized in 1 day because of the issues, the financial issues involved and so on. But there is goodwill on both sides. The issue of the management of health services in the county, I would want to indicate that as governors, we are putting in place contingent measures to ensure that health services continue at the counties. Unfortunately, of course, it will have to be at a level that would be unacceptable, but we are hoping that this matter is resolved quickly, because there is goodwill on the part of us, on the part of county governments, and on the part of national government, the way I've seen it. All that we are asking is that the nurses come on board. As for the doctors, it is the issue of the collective bargaining agreement, which was signed in 2013 before devolution, before we came in. That collective bargaining agreement was signed by national government at that time. But we have all agreed that we will look at it, and that's what we were discussing with the doctors this evening. We also agreed with them that we will meet tomorrow with them at 8 in the morning. We are hoping that we continue that discussion to a level where we will be able to solemnize the discussions, and so that the services can resume. So I want to assure Kenyans that we are working, and that's why we were here last evening. That's why we are still here, to ensure that this matter is resolved. Thank you very much, ladies and gentlemen.
Thank you so much. I think you can ask questions. I'm sure you have some questions which will need to be answered. Any question? I think what we are saying is we will pursue this dialogue to logical conclusion. It must be done within the framework of the law. It must be done within the framework of Salary and Remuneration Commission and the guidelines which are provided. We must do this discussion.
Well, another unprecedented press conference at the Afya House concerning the doctors' strike. This is just day one, and there have been several reports of deaths across the country following the doctors downing their tools. That is just a press conference coming to you live from Afya House. We'll be giving you later updates at 9 p.m. But a quick recap on this is that the Health CS Cleopa Mailu insists that the collective bargaining agreement cannot be dealt with at this particular point until a recognition agreement is signed by the counties, and it has not been signed by the 46 counties. However, James Ongwayo is the chairman of health in the counties, say they are currently in negotiations with this to make sure that this recognition agreement is first agreed upon, and then the CBA comes in after that. There'll be more negotiations coming through at 8 a.m., but so far there's still a deadlock. They say the nurses and the doctors said they could not negotiate beyond a particular point. The doctors insist that this collective bargaining agreement was agreed in 2013. The government says that this cannot be done until the recognition agreement is done first from the counties. We'll be giving you later updates at 9 p.m. Stay tuned.